This is Riley.
So I'm here to practice my newborn assessment on Riley. Go. Say hi, Riley. Okay. So, head is normal cephalic, anterior fontanelle, posterior fontanelle are not bulging, they're flat. Sutures are approximated. Sclera is white. Eyes are clear and aligned with the ears. No skin tags on the ears.
Good boy.
Okay, nares are patent. Mouth. Stick my soft palate is intact. Yeah, hard palate is intact. There is teeth present.
He doesn't like that.
Neck moves freely side to side. No webbing. He has no belly button.
He has a pee-pee.
Abdomen is soft and non-distended.
He
has a paw bilaterally.
What is going on with this?
The toes bilaterally, no simian creases. His anus is patent.
How it is on?
No abnormalities. He's missing his balls. He has a tail. Okay. Let's see. No grasp reflex apparently, or plantar reflex. Okay.
Or child be alright.
Okay, I'm going to look at your back now.
He doesn't like that. He's gonna roll over.
Spine is straight.
Stay.
No abnormalities. Okay, now lie down again. Okay, I'm gonna check and see if he has any hip dysplasia.
This probably hurts.
No crepitus. Hips are equal bilaterally.
He doesn't understand.
Okay, and then I'm gonna
Your jaw.
listen with my imaginary stethoscope to his heart. Normal heart sounds, no murmur. Heart rate is blah blah blah. And I'm gonna listen to his lungs.
Pronounced dead. 245.
Lobes are clear. Okay, listen to his bowel sounds. Bowel sounds are present. Okay, and then I'm gonna do another reflex. Moral reflex is not intact.
He's stupid.
He's just laying there.
He doesn't understand.
Yep.
He is stupid. He's a vegetable. He's a vegetable.
Okay, and then yeah, he's missing his testicles.
So I can't do anything there.
Where's your testes at, baby?
You lost them, did ya?
And yeah, I think that's all I can do for now. Thank you for joining me on this lesson how to do a newborn assessment.
Ready? Are you ready?